Hi everyone, my name is Megan Terrio and I'm an OTA student at St. Catherine University, and today I will be doing an instructional video on how to do safe transfers. The first one that we're going to be doing today is going to be the stand pivot transfer, and then we're also going to be showing the squat pivot transfer. As occupational therapists, we stress the importance of safe transfers to move a client from one surface to another in order to do a functional task. So whether this is moving from the bed to the wheelchair to go work on some eating or dressing or anything like that, moving from chair to bath, chair to toilet, or any functional daily task. When deciding between the squat pivot transfer and the stand pivot transfer, we're always keeping in mind that every situation is different based on the client, based on the caregiver or clinician that's working with them, and the situation that presents itself. As I show you the stand pivot transfer and the squat pivot transfer, we're going to be using the help of a gait belt. Now, the gait belt goes around the client's waist and protects them from falls or any injuries, as well as protecting the clinician or the caregiver from injuring themselves while lifting the client. Another safety tool that we're going to use is going to be proper body mechanics. Now, body mechanics are not only important for the clinician and caregiver, but also for the client as well. Beginning a transfer, one of the most important things that you want to explain to the client is that they need to be able to help as much as possible. As occupational therapists, we focus on regaining a sense of independence for our clients, and as caregivers, you should help to motivate them to gain as much independence with this transfer as possible. When instructing the client on proper body mechanics, you want to make sure that you begin with the client scooting to the edge of the bed or flat surface. You want to make sure that their feet are flat on the floor and their legs are in pushing position and their hands on the side of their body so that they can lift themselves upright if possible. When it comes to being a therapist and having proper body mechanics, getting as close to the patient as possible, facing them head on, having a wide base of support, a neutral spine, and asking for help if you need it. If you don't feel comfortable performing the transfer, always ask for help for your safety and for the client's. The importance of body position is not only important in the beginning of the transfer, but after a completed transfer, it's also very important to make sure that your client or loved one is in a proper seated position, making sure that the upper extremities, lower extremities, pelvic, and trunk are all in a proper alignment. Ensuring that our clients or loved ones have proper spine and postural position is really important in preventing any spinal deformities, and it also helps to optimize their respirations. When it comes to pelvic positioning, we always want to make sure that there's equal weight distribution on both sides, which helps in pressure management, which reduces the effects of pressure ulcers, but also if our clients or patients are comfortable sitting, it optimizes the amount of time that they spend in their chair. As occupational therapists, we always want to make sure that our clients have the best possible positioning and access to performing daily tasks. So if the patient is comfortable, then they'll have the full range of their upper extremities and they'll be able to perform the daily tasks longer. The transfer I'm going to be demonstrating is going to be the stand pivot transfer. We're going to have the client start in a supine position, which is face up. And the client is presenting with just general overall weakness and balance control. Hi Cassie, how are you?
Good, how are you?
Good. My name's Megan. I'm going to be your occupational therapist for today. I understand that you're hungry and you want to get up and have some breakfast.
I'm ready. It's time.
Awesome. All right, so I'm going to have you roll over towards me. And right now you're here for guidance for her. Legs off the bed and sit up. Now I'm going to have her scoot her feet to the floor for proper body mechanics. She's always going to have her hands to the side to stabilize herself. And I'm going to use the gait belt. Can I put this on you?
Mm-hmm.
Just let me know if it's too tight, okay? The gait belt goes in through the teeth side, around the client's waist, and pulls it tight. It should be right in their waist right here. Tight enough so it doesn't slip up, but also not tight enough that it's hurting them. All right, and once you have the gait belt attached, what we're going to do, Cassie, is I'm going to, not now, but I'm going to have you stand up. I'm going to help you. We're going to slightly turn towards the couch. When you feel the couch on the back of your legs, I want you to reach back and feel where you're sitting down, and then slowly sit down, and I'm going to help you. Now, I want to make sure that we're pushing off of our arms when we first stand up, okay? Not yet. All right, on the count of 3. 1, 2, 3. All right, and then slightly move back. When you feel it, sit back down. Perfect. Next one we're going to demonstrate is the squat pivot transfer. So I'm going to have the client roll towards me. I'm going to be here for guidance. If she needs a little bit extra assistance, you're going to assist under the scapula. She's going to go up on one arm and have both of these legs off, and then you can assist and scoop her up if she needs any more assistance. If you can scoop forward using your arms, try and put your feet flat on the floor for me. Wonderful. And now I'm going to put this around your waist, okay? Again, placing the gait belt around the client's waist, through the teeth, and tighten so that it's comfortable and snug, but not too tight. Nice. All right, now with the squat pivot transfer, you want to lead with the strong side. For the squat pivot transfer, it's really useful if there's hemiplegia of one side. So we're going to lead with the strong side to the next seated position. So if you don't mind just scooching over to me. All right, so keeping good body mechanics into play, I'm going to face her straight on. I'm going to bend with my legs. I'm going to have a nice wide stance. And Cassie, I'm going to have you push off your hands, and you're going to reach over here. Now, this one, we're going to stay in a squat the entire time while we move over here. We're going to do it together, okay? On the count of 3. 1, 2, 3. Perfect. Keeping in mind her seated position when she sits down should be a 90, 90, and 90, keeping good body posture for her as well. Guiding our clients and loved ones with safe transfers is extremely important in giving them the most access possible to their functional ADLs and IADLs on a daily basis. If you have any other questions about safe transfers or you don't feel comfortable with it, please feel free to contact your occupational therapist or your physical therapist that you have for your loved one, or visit the AOTA website.org.